Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about my friends at AlignFlow, the virtual orthodontic monitoring system that they were rebranding to a new name called In-Hand Dental. There's no hyphen after in and hand. But that's kind of a cool name because they're basically saying these are things that you can do to monitor your patients in their hands, like with an iPad or a phone or something like that. So if you haven't watched my previous video that I posted yesterday about what is your refinement rate and is your refinement rate healthy, this kind of pivots and piggybacks off that. You should know what your refinement rate, what's a normal refinement rate? Well, to me, a normal refinement rate is less than 30%. If more than 30% of your patients are needing refinements, mid-course corrections, or warranty fit, you're probably doing something wrong. The number one thing that I see that people are doing wrong, besides having bad treatment plans, which is easily remedied by working with an orthodontist to make sure your treatment plans are optimized, you probably only need to do that on your first 20, 30, 40, 50 cases, and then you'll get the hang of it, and then you don't need the help anymore, probably, except for an occasional one-off. So the other issue is that people don't create an accountability loop. That is, how do you know that your patient's actually wearing it as directed? Patients lie all the time. And in their mind, they're thinking they did 22 hours when they're really only doing 17. So unless you have that weekly accountability loop or every aligner accountability loop where they're putting in their aligners, sending a picture with the aligners in before they change to the next aligner, or at least every other aligner, not seeing them every 6 aligners, 8 aligners, 10 aligners in office, you do not know if this is a compliance issue, a treatment plan issue, or a manufacturing issue, okay? So whenever doctors come to me and they're like, oh, I'm having a problem with this Invisalign or ClearCorrect or SureSmile. And I say, well, how do you know it's that? How do you know it's not your patient? So that's why we need to know your refinement rate. Now, you tell me your refinement rate is 10% and you're having a trouble on one case, okay, then you clearly have a hand on compliance. So I'm not too worried about it. But if your refinement rate is anything more than 30%, you really need to create your own accountability loop. Now, you can purchase systems like AlignFlow, which is now rebranded to In-Hand Dental Monitoring System. There's one called Grin. There's all kinds of different ones that are out there. I don't care which one you use. The one I'm most familiar with, or the ones I'm most familiar with, is your In-Hand Dental and also dental monitoring. Those are the ones I've used. We've had a lot of experience with. DM is great. It usually has AI. It's a lot more expensive, lot more expensive. And you need to buy these scan box for every patient. So there's an overhead fee for every single patient. Whereas your in-hand dental, I think last I checked, is about $140 per patient. $140 per month per doctor for up to 30 patients. So that's less than am I getting this right? I mean, it's like a few dollars per month per patient for monitoring. And that's like a no-brainer, because consider anytime you have a anytime you have a refinement in your office, they're going to take up chair time, right? They're going to take up doctor time, assistant time, scan tip, whatever. I mean, the cost of the scan tip alone is more than the cost of the month with AlignFlow or in-hand dental. So, I mean, it's kind of a no-brainer to me. And once you create your own system and get the flow going, you're basically going to have to eliminate all those unnecessary appointments during treatment, which frees off a ton of chair time, which has a value to it that you can be using for other things. I mean, think about this. 30 patients 1 month don't have to come into your office. If each check appointment is about 20 minutes, you can do the math on that. That's a few hours of chair time right there. So I'm pretty sure your chair time is worth 3 hours or 4 hours of chair time in a month is worth more than $140. But anyways, not to mention supplies and equipment. All right, thanks so much. Hopefully that was helpful. And if you're interested in being introduced to In-Hand Dental, feel free to reach out to us. We'll be glad to introduce you so you can get the best prices. Thanks.